Good morning, folks. It's time for another FYI, and this morning we have the Henry County Health Center with us today. We have Andrea Moeller and Linda Veldboom. They're both with the Cardiac Rehab team. So I know February is American Heart Month. You guys are cardiac rehab nurses, and you're here to talk about the cardiac services at the health center. So would you go ahead and introduce yourselves, talk about your education, your experience in cardiac rehab, how long you've been doing this at the health center?
All right, I'm Andrea Moeller. I graduated from the University of Iowa with a Bachelor of Nursing degree. I've been at Henry County Health Center for almost 20 years, and I've worked in the cardiopulmonary rehab department for about 17 years.
Wow, awesome. Well, so glad to have you in Mount Pleasant. And obviously, you know what you're doing. And Linda?
I went to college in Sioux Falls, South Dakota at Augustana College, and went to work at a hospital there. And after I graduated, and I have a liberal arts degree in nursing, and worked in a lot of different areas in my nursing career, but most recently has been with Henry County Health Center. I've worked there about a year less than Andrea, and I've probably been in rehab for maybe another year less than Andrea. Seems like I'm about a year behind her. So.
Well, the cardiac rehab program at the health center is certified by the American Association of Cardiovascular and Pulmonary Rehabilitation. Can someone explain what certification is and why it's significant, what it means for the cardiac patients here at the health center?
Yeah, we apply for the certification every 3 years, and this involves submitting data. We track outcomes in the cardiac rehab program, and it shows that we're meeting national standards. We're following the guidelines and caring for the patients, so keeping current with guidelines.
Explain what heart disease is and who is at an increased risk.
Heart disease is the main form of cardiac disease, and it is basically just a disorder of the blood vessels that of that heart that can lead to heart attacks. And so it's important that we are aware of our bodies, how we're feeling in that, because heart disease is the number one killer in America. And so we need to really know what the risk factors of developing heart disease are. And just a few of those are smoking, if you have high blood pressure, making sure you take your medication. If you're a diabetic, making sure you keep your blood sugars in a normal range. Of course, age, how old we are, whether we're a man or a woman. And then to diet, what we eat, and then the exercise can help a great deal.
With heart disease, a lot of people are worried about heart attacks. So what are the signs and symptoms of a heart attack, and what should people be aware of, and when should they seek medical attention if they think they are having one?
Yeah, signs and symptoms of a heart attack can vary from person to person, so it's really important to know all the symptoms. It could be chest discomfort, pain down one arm or both arms, increased shortness of breath, could even be back pain. We've had some people experience jaw or teeth discomfort. And then for some people, sick to their stomachs, nausea or vomiting. And when you experience any of these things, you should seek medical attention right away. We've heard that time is muscle, so you want to get help right away to preserve your heart function, to help that heart muscle, and to, of course, increase your survival.
Talk about then how cardiac rehab comes into this, the services that are offered through it, and the cardiopulmonary service departments at the Henry County Health Center.
Well, at Henry County Health Center, the cardiac rehab department has actually 3 phases of cardiac rehab, or to that program. And the first phase is services that a person receives while they are in the hospital. Typically, it's right after a heart attack or bypass surgery or something like that. some kind of an event. And then once you're discharged, the doctor will write an order for you to continue with that rehab. And that's kind of where we get involved. We are phase 2, and that's once you're discharged from the hospital. You would come to us and we would put a heart monitor on you and monitor your exercise, the rhythm while you're exercising, your heart rate, and how you're feeling. And then there is a phase 3 that we also offer, and that is for anyone who has heart disease, whether you've had an event or not, or anyone that wishes to exercise with supervision. We do blood pressures through that program as well as monitoring heart rate and that. So that's kind of what our program is at Henry County Hospital, and really the goal through that whole program is to strengthen and provide increased endurance, but also to give people the self-confidence that they can do it and that what they are doing is a safe way of exercising.
How do patients become involved in the program?
Most times we get referrals from their cardiologist or family doctor. We once in a while will get a phone call from a patient, and so getting them enrolled that way.
And what diagnostic tests are available? You talked about your blood pressure. You've talked about heart rate monitoring. How do you evaluate heart health and diagnose those heart problems?
Okay. At Henry County Health Center, we have many tests that are available. We have stress testing, cardiac Holter monitoring, where a patient would wear a monitor for 1 to 2 days or even longer, up to a month. EKGs, echocardiograms, and all of these are used to detect or diagnose a person's heart function, the circulation, or any heart rhythm problems.
And talk about then also with all of these testing, you also have cardiologists that visit to see patients at the specialty clinic. Talk about that and how it's beneficial for residents to have access to specialists right here in Mount Pleasant.
Okay. We have cardiologists from Iowa City, the Iowa Heart Cardiology Clinic from Mercy Hospital, and also cardiologists from Great River Medical Center. They come to the specialty clinic every month. And we feel this is a benefit for our patients because they don't have to travel very far to have a follow-up with their physician. It's just very convenient for them.
And I did want to touch on also why cardiac rehab helps improve the quality of life for patients. I mean, what have you guys seen improve the quality of life for people?
I do feel that they have that reassurance. They are able to continue to exercise after the program is done. We have education classes that look at their stress management, eating healthy. Sometimes we refer patients to diabetes education. So just having them have an overall lifestyle change.
So if somebody has questions, needs more information on cardiac services at the health center, who should they contact and what's that phone number?
They can contact Linda or myself in the cardiac rehab department, and it's 385-6504.
Well, so glad to have you both here, Andrea Moeller and Linda Veldboom, cardiac rehab nurses here at the Henry County Health Center. Of course, February is American Heart Month, so we just want to make everybody aware of what heart disease is and what you can do to prevent it. So thanks for coming in this morning.
Thank you.
Thank you.